as quickly as 5 minutes after injection with ReViVox, those patients experienced an increase in wrinkle severity, in their ability to frown, and all of them who had ReViVox injected returned back to baseline. So it kind of proves that ReViVox has the potential to reverse botulinum toxin treatments. Welcome to episode 3 of In Clinic. I'm your host, Danelle, registered pharmacist and lead practitioner at Clinic 1 Medical Aesthetics.
And I'm Alex, co-host and marketing specialist at Clinic 1.
On today's episode, we're going to be taking a look at a really interesting and an emerging new treatment known as ReViVox. Now, what makes this treatment so interesting is that it's the first product that has the potential to reverse the effects of botulinum toxin treatment, also known as anti-wrinkle injections, or more commonly known as Botox.
So this has the potential to be a really important discovery in the field of aesthetic medicine. So why don't you start off by telling us how Botox works?
So Botox is this neurotoxic protein that's produced by this strain of bacterium called Clostridium botulinum, and its ability to reduce the appearance of wrinkles and its effects on muscles was actually discovered by mistake. It works by reducing the nerve cells' ability to communicate with muscle cells by blocking the release of a neurotransmitter known as acetylcholine. This essentially reduces the muscle cells' ability to contract. Now, this mechanism is semi-permanent, so in aesthetic treatment, muscle function tends to return to baseline after about 3 months, but once the toxin's been injected into the muscle, there's currently no way to reverse its effects. It's a case of waiting for those 3 months to pass for the effects to essentially wear off.
That is until somebody made this wonderful discovery of ReViVox. So how does it actually work?
So ReViVox is very similar in structure to these existing compounds called acetylcholine esterase inhibitors. Now, what these do is they inhibit this enzyme known as acetylcholine esterase, which is basically an enzyme that breaks down acetylcholine, which, as I mentioned before, is the molecule that's responsible for making muscles contract and passing signals between nerve cells. So if we can basically stop the breakdown of this molecule, then essentially we can increase the amount of acetylcholine that's available to the muscle cells for them to be able to contract. And this works because Botox only actually partially blocks the release of acetylcholine. It doesn't block the full release of it all. So we can basically indirectly increase the amount that's available to stimulate these muscle cells and essentially try and bring it back a little bit closer to baseline, so what it was like before we did the Botox injections.
So does this happen straight away or does it take a while to kick in?
In one study that was done to see how ReViVox works in humans, 6 patients had their glabella complex injected with botulinum toxin to treat moderate to severe frown lines. They returned back to the clinic where they had this treatment done 2 weeks later, and 3 of them were taken and had their glabella complex injected with ReViVox. The other 3 had their glabella injected with saline basically as a control, and then they had their frown severity measured using like a standardized scale to make sure that the measurement was the same for all patients, whether they were injected with ReViVox or saline. And as quickly as 5 minutes after injection with ReViVox, those patients experienced an increase in wrinkle severity, in their ability to frown, and all of them who had ReViVox injected returned back to baseline. So that means that their wrinkles came back just as strong as they were before they had the treatment. So it was a very early study that was done, and more needs to be done essentially, but it kind of proves that ReViVox has the potential to reverse botulinum toxin treatments.
That's amazing. So what are some real life use cases where this could be used in aesthetic treatment?
Well, there are 2 clear instances where I could see this being used in aesthetic treatment. So the first would be in the case of an eyebrow ptosis, which is basically a dropped eyebrow. Now, ReViVox could be used to restore some muscular function to the lower portion of the frontalis muscle, which is the forehead muscle, and this would essentially re-engage support in that area and help lift the eyebrow back up. Now, the second case where I could see this being really useful would be in the case of an eyelid ptosis. Now, that's where we cause the eyelids to drop by inadvertent injection of Botox into a muscle known as the LPS muscle, which is essentially a really small muscle that helps a person to keep their upper eyelid open. Obviously, reducing the ability of that muscle to contract would cause the eyelid to drop a little bit. So using ReViVox in this situation would essentially allow the person's eyelid to return back to its normal resting position.
And how are these side effects currently managed?
Well, both of these issues can be corrected somewhat by injecting more toxin just into the opposing muscle. So, for example, in the case of a brow ptosis, where the lower portion of the frontalis muscle has basically been knocked out and support to the eyebrow has been lost. By treating the opposite muscle to that, which would be the orbicularis oculi, which is like a ring-shaped muscle that sits around the eye socket. Essentially, when that contracts, it draws everything inwards and towards the eye. So if we treat the upper portion of that muscle with Botox, we can essentially help the brow sort of raise back up a little bit and stop the pull of that muscle being exerted onto the brow and stop it from being pulled downwards. And that can somewhat correct an eyebrow ptosis or at least improve the appearance. By injecting another part of the orbicularis oculi muscle, we can improve the appearance of an eyelid ptosis. So if we inject the part of the muscle that sits over the upper eyelid and helps the upper eyelid to close, we can essentially counterbalance the effects of injecting the LPS muscle. But we can also do this by using eye drops, which are prescription only. They contain an alpha receptor agonist, which basically stimulates the LPS muscle when we use them. So something like oxymetazoline or aproclonidine can be used to also stimulate that LPS muscle, help open the eyelid a little bit, and basically improve the appearance of an eyelid ptosis by roughly 1 to 2 millimeters, which doesn't seem like a lot, but when you've got a pretty severe eyelid ptosis, 1 to 2 millimeters really can make all the difference.
So the discovery of ReViVox really is a game changer then. Is it something that's available now to use?
So although ReViVox has shown some really good early promise for being a great treatment option to reverse the effects of Botox in humans, more studies are needed. The one that I mentioned earlier on with the 6 patients, that was a very, very early study. So there's still a bit of a process that needs to be gone through for this to reach the market. But the fact that it's very similar in structure to existing acetylcholinesterase inhibitors that are out there shows really good promise. And I think this will progress through sort of the marketing authorization really quickly.
So when are we likely to see this come to market?
So the company that discovered ReViVox are hoping to have all the clinical trials completed and the product available for wider use in the market within about 2.5 to 3 years. So if you'd like to book a consultation with us or you'd like to know a little bit more about the treatments that we perform, you can hit the link that'll take you directly to our link tree where you can access our WhatsApp, where you can basically give us a call or send us a message to book your consultation. And you'll also get access to our treatment guide, which gives you a lot of information about the different treatments that we offer here and answers some frequently asked questions as well.
Don't forget to like and subscribe if you've enjoyed watching today's show. Hit the bell if you're watching on YouTube to get notified when the next episode's out, and leave a comment if you have anything interesting to say. Thank you for watching.